Councillor for Fulham Broadway. Rachel Ford and Matt Thorley. I wish them well in their personal lives and thank them all for all that they did. That was good. I grew up in Fulham. I love Fulham. The vibrancy of North End Road, the football clubs, the streets and the estates. And the people that make it a diverse community, which I believe is the finest district in London.
Yeah.
As you can imagine, I am deeply proud to represent Fulham Broadway, and I pledge to work hard as part of this new Labour administration to improve the area, the lives and the life chances of those who live there. Charing Cross Hospital, the local A&Es and health services that support the residents I represent are as much part of that life in Fulham as anything else. I treasure about our neighbourhood. I know how easy it is just to take things for granted, but I know that the reason we have high quality health services, free for all, irrespective of anyone's ability to pay, is because our forefathers and mothers campaigned for the NHS, argued for the NHS, and the wonderful post-war Labour government delivered the NHS.
Yeah.
To make sure the NHS is safe on our watch. And while we always recognise the need for modernisation, we should always be watchful of those who dress up the dismantling of our NHS in the clothing of modernisation to discard their real purposes. So what is happening to our beloved NHS, our A&Es and Charing Cross Hospital? I guess the surest indication that something was wrong was when Jeremy Hunt, the Health Secretary, popped up on our TVs last month to apologise for what, for all intents and purposes, is a crisis with our NHS. And I guess the surest indication that this problem is intrinsic to the government's health changes is that Jeremy Hunt, the same Health Secretary, admitted that even he took his children to an A&E and not a GP because, and I quote, he could not wait.
Well done.
I sympathise for anyone who has sick children, but let us also consider the fact that at Northwood Park Hospital's A&E there has been ambulances jammed, waiting for up to an hour before the emergency patient inside can be seen. And closer to home, Councillor Lukey has just detailed, we have St Mary's A&E failing its CQC inspection and Hammersmith A&E closed. And when the government says A&E, what exactly are they talking about? But at a health pack last autumn, even the medical experts told us there was dangerous levels of confusion. The reason? Now the government has 3 categories of A&E. A Class 1 A&E is what you and I would expect, with fully functioning A&E emergency blue light services led by senior consultants and other senior clinicians. A Class 3 A&E is exactly the same as, you guessed it, an urgent care clinic. That's right, an urgent care clinic led by GPs with no capacity to take blue light emergency patients. So when David Cameron came to Hammersmith and Fulham and promised that he would save the A&E, was he telling the truth?
No, liar.
And nothing but the truth? Or was he involved in deliberately trying to mislead the journalist who reported what he said and the people who would read it? It's hard to believe that he could not know that these new A&E classifications, so I put it to you, Madam Mayor, that the Prime Minister knew all too well that he was deliberately misleading people about the future of Charing Cross Hospital's A&E. Disgraceful if true, and the evidence doesn't really allow for any other conclusion. In direct contrast, the Labour administration is doing exactly what we said we would do, and we're standing up to defend our hospitals. And the smart way to do that is by a public inquiry. An inquiry that will look at the evidence, gets to the facts, and make sure the people we represent know the truth. And the new government has the evidence to do the right things. Put a halt to this NHS crisis and save our NHS.